Namaste. Welcome to the third episode of Mamta's first podcast series. I'm Dr. Neha Bhardwaj, moderator for the podcast today. As our podcast focus all the topic related to public health, and whenever we talk about public health, healthcare facilities always remain an immense part of the discussion. So we thought it would be interesting if we can discuss some questions related to primary healthcare. Primary healthcare. Why it is so important? It is important because it is essential and affordable. Affordable care which is accessible to everyone in the community, which further includes health promotion, disease prevention, and health maintenance, and much more. So, to enhance our knowledge and give us deep insight on primary healthcare and healthcare facilities, we have with us our expert speaker who has more than 30 years of experience in program management and strategic planning in the area of development sector, Mr. Sanjeev Dham, sir. Sir has done his masters in marketing and also in personal management and industrial relationship. Mr. Dham has also done course in strategic communication from Johns Hopkins. Sir's contribution to the area of public health is quite dense, and we can keep on talking about his contribution and his experience. So I'm keeping it short considering the topic of the podcast today. So we are moving further. Welcome, sir. Thank you for your valuable time and the insight which you are going to share with us. So, sir, let's start with the public health institution. And we all know our country has large number of public health institutions in rural areas and also in urban areas. And if we talk about the periphery, like sub-centers are there, and at district level, district hospitals are there. So we would like to know, considering the current scenario, or we can say current healthcare system, what is your take and your view regarding the primary healthcare and future universal healthcare? Basically, how you correlate the universal healthcare coverage with the primary healthcare?
Thank you, Dr. Neha. Thanks for the nice introduction. I feel honored to be part of the podcast. Mamta is such a reputed organization working for last 32 years. It's very important that we discussed on two previous podcasts such an important issue. In third podcast, we are talking about the primary healthcare, which is one of the important issue for the country per se. If we discuss about the primary healthcare system, it is considered as a base of the healthcare system. As a primary healthcare is the first point of contact for the community. Aim of this whole system is to make the healthcare system accessible and affordable to each individual of the community at very affordable, so that we can see the reduction in the out-of-pocket expenditure for them, because we see the vulnerable community face the challenges of economic burden. Effective primary healthcare system decrease the load at secondary and the tertiary care and the lower the economic burden of the country. It is also ensure the people receive quality and comprehensive care through the primary healthcare system. The universal health coverage, which everybody's talk about, is the right for each countryman to get the quality services at the first point of contact at sub-center or at PSC. We have a great policy, but I could see the challenge lies with the implementation. So it's an important, this area need to be strengthened in terms of right implementation, to support through the support of digital system which can help in achieving our universal health coverage goal that we committed at a UNO.
Yes, sir. Rightly said. Like you just mentioned, digitization can be helpful in strengthening primary healthcare system, and it can be helpful for any healthcare system. So we would like to know more about it, and you may agree with it that in current scenario digitization influences almost every aspect of the life. So how it can change the healthcare system? It can be beneficial, or we have to see the other aspect of it. So we like to know, how do you see the digitization of the healthcare system?
I mentioned in my earlier the answer or response, which is for digitization. Digitization is not a solution for everything, but it is vital to improve services at the facility level, because we need to see that every system has to be in place to improve the services which to be delivered to the beneficiary. I would like to say the community, especially the vulnerable community, who are that maximum need of our services. So it's very important, because they first reach to the sub-center and that the primary healthcare center. To form the digital ecosystem in our healthcare that support the concept of universal healthcare system, and I would say in a layman language, health for all, because that's very critical, because the people who are living in the rural areas, facing hard conditions, so they should get this services through that this digital ecosystem can reach to them. Even the doctors cannot reach, but the system can reach them. So it's very important that we need to look at this as a opportunity, so that the bottom of the pyramid should get the benefit out of that. We need to understand the gap in the present system, so to bring the solution through that digital approach. The scarcity of doctors, so that's one of that the big problem that we mentioned about it. How to solve this problem? Say through the telemedicine, so through the system that we can reach them. The capturing e-health record, even that every time we ask that our beneficiary to bring your prescription or parchi, that we say in our layman language. So parchi, they don't bring parchi, because reason is that because they forget that at home, because they are in the pain, then they reach to the primary healthcare facility. So important for that is capturing e-health record is going to help us to give that data to serve our beneficiary in a better fashion. The capturing the information in real-time system, so that we can see that what's going on in that particular community or particular area, so that we understand the disease burden and we can have customized approach for them. That's very, very important. And also very important that we always say that the nurses are serving our country at hinterland. Can we empower them more? Can we learn from our neighboring countries, and more that we can have a skill-based training for them and virtually support them, higher level provider, to see that digital ecosystem is working very well and serving the community. So the minimize the reporting error, the reduce the cost of the maintaining the physical record. In addition, this platform which available online, easier to access for everyone, including the community also. If they want, they can access on their phone also. That should be our approach to look at the digital ecosystem. It also helps to empower and enhance the community members in communication with the healthcare professional. They can say, we came last time, you can look at your record, they can ask the provider to help them better. That's very, very important, that we need to send that they should communicate in two ways. The provider as well as community also interact through this digital ecosystem. And human resources may require additional training and capacity building in the healthcare system, but it is important we need to adapt this digitization process in this whole system at a primary healthcare level.
True, sir. It is important to be cautious, and it is also very important to do the strategic planning whenever we talk about digitization of a healthcare system. Rightly said, sir. Like, sir, you just mentioned about the primary healthcare system, and we got to know more and more about the digitization of the healthcare system. It will be great if you can tell us about the approach. What should be the approach to strengthen the healthcare system, like sub-centers, PHCs, CHCs, the idea of revamping of the healthcare system, or how we can strengthen the healthcare system?
Idea of revamping at a bottom of the healthcare facility is very critical, especially the sub-center and the primary healthcare center. The point of contact for the rural or the slum population, I see that's these two centers where people first reach that. And it's important, we need to strengthen that. And the grassroots level support health system is a very, very critical. The sub-center and PSC should be strengthened to provide essential package, which already defined in in our public health system. So those comprehensive packages must be delivered, and we should track through the digital ecosystem whether those services being delivered or not. The health system strengthening comprises right strategy, which I already mentioned. We have a good policy, but response of those policies, which means real implementation at the ground, and tracking through the digital ecosystem is a very critical, and activity that are designed to sustain and improve the country health system. Look at that COVID, that how that our system is being crumbled. If you have a data, how many people are been suffering for particular disease, like non-communicable disease, can we service them better? So we have a data for age-wise, but can we have a data with the disease burden that can help us in a better fashion? The main focus is being and should be given to the service delivery of available service, along with the integrated focus on the Indian system of medicine. We should see that whatever resources available in the healthcare system, can we use them optimally? It's a very, very critical for us. And we see that all that time we should not look at negative part of that scarcity of doctor. How can we look at that to whatever the available resources, can we use them optimally? The important for us as a focus should be on the quality of services, delivery, availability and accessibility. So can we use that nursing staff, use a digital ecosystem to see that services being reached to the last mile? That's very, very important, critical. Use of technology in the health system can be strengthened. It's a very vital that required to the close monitoring for especially the hard to reach population, most vulnerable community. So I would like to conclude this particular piece that we highlighted the importance of a tech around the healthcare system through this podcast in the hope of this being effective. I hope that people who are going to listen this should give us a feedback, give us suggestion that how can we improve. This suggestion can also help us in improving and giving suggestion to improving our healthcare system. Thank you very much.
Thank you so much, sir. We are feeling really delightful that you shared such an immense knowledge with us. Thank you so much, sir.